So the setup of the tray is extremely important, and it really should be the exact same way every single time. The reason is that as a surgeon, I expect all my instruments to be in a certain place, the same place every single time. And so your surgeon may have a different preference on how to do it. I'm going to show you what my preference is and how I like to have it the same way every single time. So it goes basically from this side to that side, and that's how I typically utilize the instruments. So the first thing that I always utilize is a Minnesota retractor, and so this is just a bent retractor which is used to retract the cheeks. And so this is a Minnesota, so we'll use a Minnesota to retract the cheek, and then we'll use the syringe to go ahead and place the local anesthetic. I typically, for a healthy patient, like to have lidocaine 2% with 1 to 100,000 epinephrine placed in the syringe to begin with. Now, the two most common anesthetics that I use are the lidocaine that I just mentioned, as well as the Septicaine, which has this golden ring to it on the top. And so for different places in the mouth, I'll use one or the other, lidocaine versus Septicaine. Lidocaine is utilized for when I'm doing a block. So if I'm ever doing a lower alveolar, inferior alveolar block, I'm going to need the lidocaine. If I'm doing just an infiltration somewhere in the lower anterior especially, and only the lower anterior, then I'll use Septicaine. We obviously like to have several of these anesthetics carpules on the tray, and you should judge how many to put on based on the type of procedure that's being done. So after that, we're going to use the periosteal elevator. And the periosteal elevator is the instrument that I first utilize after placing the local anesthetic. It's got two sides. One is a smaller, sharper side, and the other side is a kind of a broader, flatter side over here. So this is a thinner, sharper side, which is used to basically free the periodontal ligament from the tooth. And then this is the broader, flatter side, which can be used as a retractor as well. So after that, I've got basically three main elevators that I use. So these are the three main elevators. The first is the offset, which is kind of my favorite instrument. And so you can see how it has a little bit of a bend to it at the end, and you can get into posterior areas much more easily with this offset elevator. Then we have a thin, straight elevator, and then we have a wide, straight elevator. All of them are, to do basically the same thing, which is to elevate the tooth. This is a crier, or a different type of elevator, which is sometimes used in wisdom tooth extractions, not used very often. This is a tongue retractor. So this is something which the assistant will utilize usually on their side to retract the tongue, and it can usually be placed and then left alone, so you don't have to necessarily hold it the entire time of the surgery. Okay. The next is a couple of the general dental instruments, which are the mirror, the periodontal probe, as well as the dental explorer. So I might need these for different aspects of extractions. And then I have the surgical curette. Okay, the surgical curette is used to clean out the extraction socket once the tooth has been extracted, to clean out any residual infection or cyst or anything else that might be left in the socket itself. These are rongeurs. These are micro rongeurs. You can see, if you've seen other rongeurs which have much larger tips, these actually have much thinner, smaller tips on them. And I like these because I can kind of grab onto smaller things and remove any granulation tissue or other infected tissue out of the extraction site. It's also utilized to extract root tips. If a root tip is there and I can grab hold of it, I'll use this to remove it. Now it's very important, once I use this to clean some tissue, that you have the oral surgery assistant has a gauze ready to wipe off the tip to clean it off so I can utilize it again. There's a second Minnesota retractor for the surgical assistant. And these are just college pliers, which are also sometimes utilized in the extracting or removing little pieces of tissue or a little root tip. Then we have bite blocks. There are 2 bite blocks on each tray. There is an adult size bite block and then a child size bite block. Then we have what are called east-west elevators. So these are used mostly for mandibular molar extractions, but these can be used in any type of extraction, but these are called the east-west. And then finally over here we have one more set of elevators, which are the root tip pick elevators or root tip elevators. And you can see these are much finer and kind of narrower, so you can get down into the socket to get any residual root tip out. Then after the tooth has been extracted, we can utilize tissue forceps. So these are a little different than the college pliers in that they're a little bit shorter and stronger, and they have either teeth or no teeth. You may be able to see that this one has teeth on it, so it actually has little things that kind of interlock or interdigitate over here. Then we have the suturing, the needle holder. So this is a needle holder, and I like these fat little serrated type of surfaces to them. It's very important to note that a needle holder is very different than some other types of things that kind of look similar to it. So a needle holder is specifically designed for suturing. And then you have scissors to cut the sutures as needed. Okay? So that is the basic setup of the tray. Now again, it is very important to set it up exactly the same way for every single procedure so that the surgeon knows exactly where to reach and where to go for that specific instrument. It's also important not to leave off anything so that if something is needed for the procedure, that it's actually there on the tray. The last thing, which is not really an instrument, is irrigation. And so irrigation is utilized usually at the end of the procedure or sometimes during the extraction to kind of clean out the blood or any other tissue that might be in the extraction site. It can come in a 10 cc syringe like this, which is filled with sterile water, and it's sterile inside and outside as well. Or it can be in a monoject syringe, which again we use sterile saline to put in that monoject syringe. And that is the full simple extraction setup that we have for every single dental extraction. The last thing that are utilized, that may be utilized in extractions, are dental forceps. And we have these wrapped separately as a package of 4. And when you open them up, these are the 4 surgical forceps, dental extraction forceps. So you have to be able to identify all of them just based on looking at them. This is a upper surgical forceps. You can see how it's curved. The curve goes from this side on top, this way, and then kind of curves back around. That is different than a lower dental forceps, which kind of just has one single curve to it. So this is a lower extraction forceps. Then we have what's called a cow horn forceps, and you can see the beaks of the cow horn they're kind of shaped like a cow horn, and that's why it's called a cow horn. This is used mostly for lower mandibular extractions. And then the last one is the Ash forceps. So the Ash forceps has this special right angle, or it's also called a right angle forceps. And you can see how it's a right angle over here. And this is used mostly for lower premolars or lower anterior teeth. So the Ash forceps. So you've got 4 forceps, the lower forceps, the upper forceps, the cow horn, and the Ash forceps over here. And that is the whole surgical tray for every single extraction setup.